to earn. You know, you are unemployed, you go to work for a company, we cover your workers' comp, you go in, you get your unemployment, you go to work for somebody, the chances are you're going to get hired. They do this in the state of Georgia, so we're implementing our own program. We think it can make a difference.
In the MBR, the governor challenged us to find better ways to deliver services. And in some cases, the system itself is the barrier to doing better. The MBR created an opportunity to fix that. 1 year ago in this room, we talked about the Office of Health Transformation's first priority, which was to modernize Medicaid. And in his introduction, the governor walked through some of our successes in that area. This year, in 2012, we're going to focus on streamlining health and human services. The goal is to share services in a way that improves customer service and reduces costs for taxpayers. OHT has more than 50 initiatives in the MBR. Each one is summarized in detail on the Office of Health Transformation website, but I did want to give you a couple of examples. Eligibility. There are more than 150 categories of eligibility for Medicaid alone in Ohio, and the computer we use to determine eligibility is more than 30 years old. The governor's jobs budget gave OHT the authority...
Oh, come on, that can't be true.
It's true. 150.
That's just crazy.
The jobs budget anticipated needing to update that and gave OHT the authority to do that. But now in the MBR, we're extending that authority to all health and human service programs. So it's going to be a comprehensive eligibility modernization initiative. The governor mentioned earlier this second point, health information exchange. Current privacy law in some cases in Ohio applies a different standard for health information than federal law, creating confusion about when health information can be shared. The MBR clarifies that for the purposes of electronic health information exchange, the federal law applies. This is critically important to get the right information in the right place at the right time to improve care. We're piloting a new Agencies Without Walls program to identify best practices for sharing data, personnel, funding, and other operating resources across state agencies. We're going to use what we learned there to design a more effective state health and human services permanent governance structure. And the details of that will be in the next budget. And also we're encouraging shared services among local agencies, including new authority in the MBR that builds on a 3-county pilot enacted last year that allows county job and family services departments to share services. Some examples of program improvements. The first one's really important. For many children with developmental disabilities, they're in school, they're thinking about what to do next, and they're routed into sheltered workshops to learn job skills. Instead, we will help them find a job in the community first, and then, if that doesn't work or isn't appropriate, only then consider the sheltered workshop. Employment first. Paying for performance in hospitals is a...
Hold on for a second. Please don't ignore this. This is easy for you all to pass over. If you have a child that has a developmental disability, they get put, the default plan is they go into development, they go into these sheltered workshops, they make like, I don't know, $1 an hour or something. But some of these kids are very capable of going out and working at places like Lowe's, where they can earn, you know, $7, $8, $9. John Martin's not here, but a couple things happen. One is they earn a little bit more money, and secondly, we're now allowing them to use the skills they have instead of putting them into a place where the skills that they have cannot be developed appropriately or properly. And this is like a big deal. I mean, maybe it's not a big deal for people that drive, 80 miles an hour, but for those that live in this world, this is a really important thing. And I tell you, John Martin has done a heck of a job in getting people to work together, to share support services, to have common superintendents in multiple counties. You see, these people always get run over. And this is an example of where we're saying we're not going to do that. If we can eliminate turf, if we can combine overhead. If we can share superintendents and staff, there's more dollars to support people who find themselves in these circumstances that, you know, at times are extremely difficult. And to allow a developmentally disabled person to be able to use their full range of skills is just a great thing to do. And I don't want to just breeze past that, because too often those with developmental disabilities or mental illness or whatever, right, we don't pay enough of attention, and we try to do that here in the administration. I don't think that makes us anything other than doing what we ought to do, and it's important to all of us.